You're welcome to another episode of Fertility Talk with Olarunke Thaddeus. How has been your day? It's been a while. On today's topic, I want to talk about what you can do after a failed IVF treatment. I know that a lot of women have suffered failed IVF. Some had done treatments for more than one time. I met someone that has done it 10 times. I met another that has done it 20 times. This further connotes notion that IVF is 50-50 according to some people, but I do disagree with this. Okay, if you've been following our page for a very long time, you know I tell you that our IVF success rate is not 50-50. At least for every 10 treatments, 9 of them works with us. What have we been doing differently, and why are you not getting results? Okay, if you're doing your IVF. So let me just quickly wrap this topic up. I'll just throw some points, and you can just go and review and think about it and see if it is something you can do after. What is IVF to start with? IVF means in vitro fertilization. It's a fertilization that takes place outside the woman's body. So your eggs are retrieved, fertilized with your husband's sperm, and the embryos are generated, and these embryos are transferred back into your womb. Okay, so that is the process. So if the eggs are good and the sperm are also good, then the womb is good, then at least you can increase your chances to about 90% if you have all these factors very good. Okay, so when there is a failed treatment, most of the time it has to do along this line. Is either the sperm has issue, or the eggs has issue, or the womb has issue, or on another part it could also be that the embryos are not dropped properly, okay, by your doctor. Okay, so because there is a position where the embryos should be dropped. So all these are factors that needs to be considered if there is a failed IVF. So this is my take on failed IVF treatment. If you have suffered one, go back to your hospital, have a review of your treatment, discuss with your doctor, ask questions such as why the treatment failed. If he is able to, or she able to identify why your treatment failed, be rest assured that by the time your treatment is done second time, then that issues would have to be addressed. Okay, so this is what we normally do if you're doing your IVF with us. Only in few cases that you will have a failed treatment without a reason. Yes, only in few. I know what I'm talking about. Most of the time, there are always reasons when your IVF treatment fails. If your doctor is able to recognize this reason, then you have done well, because trust me, it's the second cycle, he would need to address those issues for you to move past that stage. Okay, so very important you go back and have that discussion. Okay, so if you have done second cycle with the same person and it's still not working, then I would probably advise that you change hand and move to another doctor. Yes, I normally say that a lot of times. Sometimes all you need to do is to change hands. That is all you need to do. Okay, because there are different protocols, there are different drugs, and there are different technique of dropping the embryos. So that could just be the problem as well. So you might change hand, and hopefully things work out for you. So these are just my few tips of what you can do if you've suffered failed IVF. So I hope this helps somewhat. Thank you for watching today's episode of Fertility Talk with Olarunke Thaddeus. For more inquiries, kindly comment below or call the number showing on your screen. Don't forget, you can also send us a DM to book your consultation. Thank you and God bless.